Hello, my name is Dennis, and I will be summarizing an article called Resistance Exercise Training for Anxiety and Worry Symptoms Among Young Adults, a Randomized Control Trial. The purpose of this article was to validate the effects of resistance exercise for young adults with anxiety or worry symptoms to see if exercise is an effective way to treat anxiety symptoms or worry symptoms. Participants, they were recruited via email, posters, or in person. They were categorized as either having anxiety or not having anxiety. There were 28 participants in total. 64% of them were female, with a mean average of 26. And all participants were monitored in a lab setting. For the intervention, a resistance exercise training program was designed to resemble the World Health Organization and American College of Sports Medicine. They used their recommended exercise guidelines to design a program. The intervention lasted 8 weeks, twice weekly, and it increased resistance progressively. Exercise included barbell squat, barbell bench press, hexagon bar deadlift, seated dumbbell shoulder lateral raise, barbell bent over rows, dumbbell lunges, seated dumbbell curls, and abdominal crunches. There was a few exercises, and they seem, um, pretty cool. Resistance exercise training sessions were held again in a facility or in a lab setting, and participants were privately monitored on a one-on-one basis. It was just the investigator and the participant, and every once in a while they would have someone come in just for extra help if they needed it. For the control group, participants were either categorized as having anxiety or not, and those who were categorized as having anxiety, they were diverted to the parallel resistance exercise training program, and those who were not, they were put on a wait list, and participants who were on the wait list, they were offered the resistance exercise training program, but no data was actually collected. And anxiety symptoms were the main concern of the study, and it was measured using a state trait anxiety inventory, and it's one of the most widely used anxiety measures for resistance exercise training, and it has a strong internal consistency. Anxiety was measured at baseline, so like pre, and then 1 week, and then 4 weeks, and then lastly at post. And also worry was also measured at the same thing, baseline, week 1, week 4, and post. Main findings were that resistance exercise training actually did reduce anxiety symptoms, but for worry, they didn't see a significant increase. So it didn't really necessarily help worry, but in anxiety, it definitely did. Some of the strengths were that the participants completed a 3-week to twice weekly participant trail that allowed participants to become more familiar, so they were able to practice the trial just to become a little bit familiar with it, so it's a little more accurate. And in addition, they would have an investigator. It's just a one-on-one, but sometimes they would have an additional person come in just to help out. Some of the weaknesses were that there was a small amount of participants. There were only 28. And also 64% of them were female. So this kind of creates an imbalance. It would probably be a little bit more accurate if it was 50-50. But overall, the article concluded that there was a significant reduction in anxiety symptoms among young adults with anxiety. Thank you.